Hi, welcome to your presentation from Sutton Benefits and Pension on your employee benefit plan with Crestline Coach. My name is Stacy Frost, and I'm here to share with you all the great things about your benefits plan. Just a quick snapshot, first of all, of our team here at Sutton Benefits and Pension. We are a wealth planning and benefits and pension firms. We do have personal financial planning and insurance, as well as the benefits and pension that we support for our clients. We are a local firm, second generation firm within Saskatoon, and happy to be working with your team. So we're going to review your policy with Sun Life. So this is your employee benefits plan with Sun Life. The policy number is 103645. All new employees have a 3-month waiting period or probationary period to be on the plan. They must work 30 hours per week to be eligible for coverage and employed on a permanent full-time basis. Coverage or benefits are mandatory in your organization. If you have coverage for health and dental through a spousal arrangement, you are welcome to waive those benefits should you choose. Just a few items to remember when you're moving through your employment with Crestline. If you do get married while you are with Crestline or have a baby, make sure you're reporting those changes to your plan administrator as soon as they happen. We do want to get those items captured on your employee benefit plan. Also, remember that that might impact your beneficiary for your life insurance, and do update that at the same time on the app that you will have access to with Sun Life. You can actually update your beneficiary right on there, so it's really easy to do. If you do have coverage with a spousal arrangement, so you have double coverage, you can coordinate the claims between the two policies. Essentially, you as the employee with Crestline would go through your plan first with Sun Life, and then your spouse would go through their plan with the carrier that they are with. And then you coordinate back through the two plans after the payments have came out. For children that are covered under the policy, it is whoever's birthday is first in the year. So if your birthday as the employee is January and your spouse's birthday is in February, then Sun Life and Crestline will pay for that dependent's claim first and then coordinate back through the other policy. We do talk a little bit about cost share. We know that you're paying part of the premiums for your benefits plan, and there are good reasons for that, and it has to do with tax. And I'm going to talk about that when we get further in the presentation. Before we move too far, I do want to reference the app with Sun Life. It is very, very good, very user friendly. There's lots of information on there that I'm not even going to go into today, but you can definitely submit claims, see what claims have been paid, see when you're due for your next services. You can find healthcare practitioners on there, manage all your preferences. You can really do a whole lot within that Sun Life app. And I do encourage you to download it today, get yourself set up, and use that for all of your future claiming and for details about your plan design. So we'll start first into the life insurance and accidental death and dismemberment. Your plan has a 1 times annual earnings to a maximum of 300,000 for the life insurance coverage. You see it does reduce at 50% at age 65 and terminates at age 70. That is your coverage as the employee. As the dependent, you do have 10,000 for spouse and 2,000 for each dependent child. So some little extra coverage there for your dependents listed on the plan. Another great reason to make sure they are listed correctly within your enrollment. You also have accidental death and dismemberment coverage. And what that is essentially a separate policy. If you were to pass away in an accident, the life insurance and the AD&D would pay. So it's 1 times annual earnings for life and another 1 times annual earnings for the accidental death. There are also payments based on whatever the dismemberment. So if you survive an accident, there may be some payouts based on what is listed in the contract. I do recommend you go and have a look at your booklet, go and look on system and find out what that looks like for your policy. Next, I'd like to talk a little bit about the disability insurance. And this is essentially an income replacement for you outside of your employment. So, with your employment, workers' compensation would be your first payer if you were injured during work. Outside of work, this will be your payer for your income replacement. You have short-term and long-term disability. Crestline has put a lot of care and attention into designing these plans with you in mind. This would be the benefit that you really pay for as the employee of the plan with Crestline, and it is for tax reasons. So if you were not to pay this, tax would come off if you ever had to claim the benefit. But because you're paying these premiums, there's no tax consequences if you ever claim into them. And the way that they're structured, we want to make sure that that is always happening for your disability earnings. The coverage for short term does have a waiting period, first day of disability due to accident and hospitalization, and then 7 days as a result of illness. It is payable up to 17 weeks when you would move straight from there into long term. And your long term is eligible up to age 65. Each of these benefits are really a claiming situation. So you would have to complete an employee report, and you would also have to get a doctor's report completed to be eligible into the claiming process. Just be aware that it is a bit of a process, but we are here to assist you should you have any issues with your claims. Now, on to the benefits that you'll use more on a regular basis. We wouldn't necessarily want you to have to use the disability or life insurance, but it needs to be there for you to take care of you and your family. The prescription drugs is listed here, will be the first benefit that we'll talk about. It has 80% coverage on generic prescription drugs, up to 25,000 annual maximum per person per calendar year. It is based on mandatory generic substitutes. So those pharmacies will dispense a generic product so you can get the most access to the longest level of coverage with less money out of your pocket. This does include a drug card with TELUS. So that drug card is part of your app with Sun Life, and you can download the app. You can download the drug card right into your picture files and save it should you need to use that as well. This is a good opportunity for you to also be a smart consumer. If you are interested, Costco Pharmacy has the lowest dispensing fees, and they also have the lowest brand markup. So for a pharmacy option, we find they're really great. You don't have to be a Costco member. You can bypass that membership area, but just a great option. They also have a mail order pharmacy. I do recommend you go onto the Costco website and you'll see all of the benefits of being with Costco for pharmacy usage. There are other alternatives as well. This is just an idea for you. On to your healthcare benefits. You do have 100% coverage in your healthcare up to certain plan maximums. Some are calendar year maximums and some are based on the date of service. So just be aware of that when you look in your booklet. But your paramedical practitioners are $500 per person, per practitioner, per calendar year. So you can see there's a list of practitioners there, and I encourage you to have a look. This is a great opportunity to be preventative, take care of your wellness, and potentially not end up in a disability situation. We've also listed some of the other benefits in the healthcare plan, ambulance, semi-private hospital room. You can see there's just a few there. I do encourage you to go and look at the booklet and onto the app with Sun Life for more information. Your healthcare coverage also includes travel insurance. So if you're looking at going on a trip anytime soon, you do have some travel included with your plan with Sun Life. It is all on the mobile app as well. So I encourage you to go and have a look at that. If you are taking a trip and have questions about the travel, I do encourage you to make a phone call to that 1-800 number, ask them all of your questions, and they will help you with all of your concerns on that travel policy. Just best to be confident in the plan prior to taking your trip. Regarding the next benefit here is vision care coverage, and you have eye exams covered under your plan with Sun Life at 100% up to certain plan maximum there. So the adults are every 24 months, children every 12 months, and it is based on a reasonable and customary reimbursement. So what that means, again, smart consumerism, go to place that actually does not overcharge. So you can look on the Sun Life app and you can easily find a list of practitioners, included the massage therapist, all of those practitioners, as well as optometrists that charge at the reasonable and customary reimbursement level. And it's just a great opportunity for you to get the most money out of your coverage. Regarding your dental benefits, now on to that. We've got 80% coverage for basic, 50% coverage for major, up to $1,500 combined basic and major annual maximum per person. So you, your spouse, and any dependent children. There is a bit of a list there of what would be covered under basic and what would be covered under the major services. My suggestion is at the dental office, if you have a claim that's around $500 or more, do get them to send in a predetermination or a quote to Sun Life just to find out what would be covered and what would be left outstanding, so you know what would be out of pocket for yourself before the services are done. Now, speaking of out of pocket, Crestline also has introduced a healthcare spending account arrangement. So this is essentially a top up to any insured components. So my suggestion is to use your benefits through Sun Life first, use your spousal benefits, whatever you might be covered through there if you have both covered, and then come back to the healthcare spending account to top that up. This is anything, it's non-taxable. There's a complete list of my HSA or HSA sample list, which I'm going to show you in a second, that you can have a look on what's covered through a spending account. For 2022, we covered $250 annual maximum, but for 2023, it's $1,000 annually for all eligible employees. So it's a great opportunity for you to use its top up. This is all administered as well through Sun Life. So when you go and complete your claiming information, if you choose to have the healthcare spending account top up your claim, so if you have some money left on the table from another claim, you can just click that response and it'll be just coming out automatically out of your spending account and reimbursed directly into your bank account that you'll set up. This is that sample list that I had mentioned, just an idea of the vast options that are available through a healthcare spending account. So it doesn't have to be health, doesn't have to be dental. You could use it for vision. You can use it for orthodontics, whatever you choose. Those dollars are yours to spend as long as it's an allowable claim through CRA. And this is actually the CRA list. That's why it's so crazy big. But you can have a look at the sample list and find out what's eligible through the spending account. Last but not least, as a client of Sutton Benefits and Pension, you also have access to our Sutton Smart Perks. Now, this is a list of different organizations, mostly local in Saskatoon. As a local firm, we like to work locally. You can get discounts on products and services at a bunch of different organizations that we work with. You can see Motion Fitness is there, Just for You Day Spa. My suggestion, Google Sutton Smart Perks, go into that page, and then you'll click on whatever icon you're interested in seeing what the discount is, and it'll explain to you right there how you access those preferred rates. We do encourage you to do that. And again, that's me, Stacy Frost from Sutton Benefits and Pension. And that's Andrea Hansen. She is our president and advisor for Crestline. I am your service manager. And if you have any questions or need further assistance, please do not hesitate to reach out to us. Have a great day.